Good evening, everyone. Today we are going to discuss some very easy exercises which can be done in patients who are recovering from COVID-19. Okay, this has been a difficult time for all of us, almost now 13 months into this, and the best way हम लोग सोच रहे थे कि how can we be of some use to the community, how can each one of us contribute to the solution rather than discussing the problem again and again. And with that intention we thought of creating this webinar जहाँ पे we can discuss about easy exercises which can be done by patients who are recovering or have recovered from COVID-19. Before even we go to exercises and we want to spend a lot of time in exercises, what is important to note is who should not exercise. What if I have fever? What if I have cough? So it's simple. The exercise which we are discussing today are for patients who are recovering or have just recovered or who are quarantined at home with not much of active symptoms. They can do the exercises. If you have high fever, you should not do the exercises. If you have breathlessness at rest, बैठे बैठे भी अगर सांस लग रही है, this is not the right exercises for you. Okay. And point number 3 is that if your saturation मतलब the pulse ox के ऊपर the saturation is less than 95%, you don't want to do these exercises. I'm not saying कि exercise नहीं करना चाहिए उन लोगों को, but उनके लिए शायद थोड़ी specific exercise की जरूरत पड़ सकती है. Okay, so you might want to talk to your doctor, talk to a physiotherapist, which I have the right exercise for you. But for the majority of others, those who are there, 95%, those who are at home, who have recovered, are recovering, okay, or have a loved one who is recovering, these would be wonderful exercises to be done. Okay. In terms of exercises, the category A and the biggest category for us today, we are going to discuss 3 categories of exercises, which are your breathing exercises. The second would be your strength and mobility exercises, and third would be return to work kind of exercises. We are going to discuss how do I return to my job, how do I return to my household work, those things. In terms of exercises for breathing, the most important thing which we want to do is to discuss about exercises which are called ACPT, that is called an active cycle of breathing technique. This technique is used in most of COVID wards and COVID ICUs by physiotherapists to help patients loosen out the secretions and move the secretions from the peripheral airways to the central airways so they can be thrown out. Okay. The biggest problem with this disease is that if the secretion stay, अगर वो sputum अंदर ही रहता है, it has a chance of getting infected. It has a chance of blocking your oxygen supply, and that's the reason why we want that sputum to be thrown out, to be moved out. So that's the reason why we are doing this as an exercise. Okay, and I want you to try this out. Okay, and we have Ashi here. Okay, and Ashi will demonstrate the exercises as I speak them out. Now, what we will do in the first exercise is you have to sit relaxed. Okay, don't sit absolutely straight. Sit absolutely straight first. Yeah, ऐसे नहीं बैठना है. Okay, you have to sit relaxed. Okay, completely relaxed. Okay, kind of leaning on the backrest. Okay, in this position you have to keep your hands over your belly. Okay, take a deep breath through your nose. Okay, and breathe out through your mouth. Okay, take a breathe through your nose. Okay, and breathe out through your mouth. Okay, इसमें ये ख्याल रखना है when you're doing this exercise is that you are not tensing any of the muscles of your neck. Okay, or you're not tensing any of the muscles of, so ये करते समय इतना ध्यान रखना है कि you're not doing this, should not happen. So you should not tense the muscles of your neck when you're doing that, and you should not be using a lot of your shoulders. तो ये करने में ये करने की जरूरत नहीं. If you see how Ashi is doing the exercises, yeah, if you see her, is that yeah, nothing in the neck, nothing in the upper chest moves. It is just the belly which comes out as she breathes in, and then she breathes out through her mouth. Okay, you can try. If some of you might have congested nose or some kind of runny nose, in which case you can take the breathe through your mouth. It's okay, but the ideal way would be taking it through your nose and breathe out through your mouth. For those who have issues with breathing through nose because of congestion, they can breathe in through your mouth and breathe out through your mouth. Okay, when you breathe out, we use the word pursed lips. That is basically you make a okay with your mouth and imagine you're blowing on a candle. So it's okay, it's not जोर से नहीं करना, it's a very very gentle way of doing it, and it is like, okay, breathe out. We'll see this one more time. Okay, with Ashi, yeah. Okay, so Ashi is sitting relaxed, hands on her belly, breathe in through your nose and breathe out through the mouth. And we do this 5 to 6 times. This part of our exercise is called as breathing control, where we are just trying to create relaxed breathing before we go to more aggressive forms of exercises. Okay, we create a baseline. Okay, so that's the first thing which you do, is to create a good breathing control. Okay, from once you do this for 5 to 6 times, the first exercise, from here the main takeaway from the exercise is that it should be a gentle breath. It should not be ये नहीं करने देना है आपको. Okay, from here we move out to slightly deeper breaths. From a normal breath we'll move out to slightly deeper. Okay, again back to Ashi. Yeah, and now the same position. Yeah, position, hands on the stomach. Now Ashi will take slightly deeper breath and hold that top position for 2 to 3 seconds. 1, 2, 3, and breathe out. Okay, so if you see, we are slowly making the exercise more and more intense. Okay, again, breathe in through your nose, hold the position for 3 seconds. 1, 2, 3, and breathe out. One more time, breathe in. 1, 2, 3, and breathe out. Wonderful. Okay, इसमें भी Tashi didn't use her neck, didn't use her upper chest much of that time. Okay, so that is your exercise number 2, which we do. Okay, which is deep breathing. From deep breathing, we'll move on to the third exercise, which is part of this only, which is many a times the infection which happens, or the accumulation which happens in the lower lobes of the lungs. Okay, so in this we are trying to now concentrate on the lower lobes of the lungs. Okay, so यहाँ पे if you see, Ashi will keep her hands on the lower lobes. Okay, and as she breathe in now, she feels for the ribs to expand. Okay, and breathe out and collapse again. Okay, breathe in through your nose, feel for the ribs to expand, hold for 3 counts, 1, 2, 3, and slowly breathe out. Okay, breathe in through your nose and slowly breathe out. Beautiful. Okay, so that's the third thing which we have done. Okay, so first we started with your breathing control. From breathing control, we moved on to slightly deeper breaths, and from deeper breaths we moved on to lower lobe breathing. Okay, these are the 3 things which we do. Okay, from there we move on to the next exercise, which is called as upping.